I'm going to discuss about hypertension. Our today's discussion will be on what hypertension is, what is actually blood pressure, and how we can prevent the hypertension. Generally, everybody would like to have healthy or normal blood pressure. There is no doubt about it. Uh, but what exactly hypertension does mean? Basically, each time, each time when our heart beats, some blood comes out of our heart. It enters the aorta, it enters the arteries, and these bloods create some pressure on the arterial wall, which produces that blood pressure. This is called blood pressure. It is as simple as that. Normally, in a healthy person, it rises and falls. For the whole long day, it never stays in the same standard. But when blood pressure remains high for a long time and left untreated, we all know it is known as a silent killer. And why it is so? If we left it untreated, then we may suffer from different problems, like cardiac problems, like kidney problems, like stroke. These are the associated problems with blood pressure, high blood pressure. Now, high blood pressure develops over time. It can happen because of unhealthy lifestyle. We all are very sedentary. Habits of alcohol, smoking, lack of physical activity. With more success, we become more sedentary. We start to consume alcohol, sometimes smoking as well. All these factors contribute to your hypertension. There are other risk factors as well, which increases the chances of hypertension. And age is, of course, an important thing. With the increasing age, there is chance of more chance of hypertension because some factors are associated with it. I am not going through it in detail. Family history is obviously an important thing. If we have a positive family history, then it's more likely that we may suffer from hypertension today or tomorrow. So we have to be cautious about it regarding our lifestyle, regarding our habits. Excess salt intake, that is the very important thing. Maximum allowance of salt per day is 4 grams. We are not allowed to take more than 4 grams per day. But unfortunately, like other bad habits, we do have that taking raw salt with our regulation food, and it does make a difference, and blood pressure goes up with excess salt intake. Not eating enough food with potassium. Potassium containing foods are very important, and most of the time we do not eat those kind of foods, possibly because of lack of knowledge, I believe, because I believe most of us are not aware of the fact that what are the fruits or foods that contain potassium. Processed food, it's a poison. I always discuss it. I have always spoken against this processed food. Anything which is processed is a poison. It contains preservative. It contains lots of bad, unhealthy things. So it is better to avoid any sort of processed food. Stress is a very, very important factor. Stress nowadays, we are running after the success. We are searching for our success, and to find that success, we are getting stressed. Unknowingly, we are getting overstressed, and stress is such a horrible thing that can lead to a number of complications, metabolic complications, hypertension, atherosclerosis complication, coronary artery disease, whole lot of things. And we have to remember that with the increasing stress, our food habit changes, our lifestyle changes, our habits changes, everything is shattered with increasing stress. Moving on, hypertension does not have any obvious signs and symptoms. That is the most horrifying thing. Sometimes patients will talk about neck pain. Sometimes we'll talk about headache, principally on the backside. Early morning headache. Early morning headache is very common because we all know that in the early morning phase, blood pressure shoots up, and at that time, patient feels some sort of headache. Sometimes patient complain of vertigo. So these are the complaints they do make, but it is most of the time it is unnoticed, and that is the most fearsome thing when we get hypertension. Some sort of in many cases we have seen that some sort of secondary damages have taken place, whether eyes are gone or kidneys is affected. So we have to be cautious about our blood pressure. Interim monitoring of blood pressure is nothing wrong, and nowadays it is easily available. So early and accurate diagnosis is very important. Like we check our sugar once in a year, we should check our blood pressure as well. If it is a home BP monitoring system, nothing is wrong in it. If it is a sphygmomanometer, traditional aneroid or the mercury sphygmomanometer, nothing is wrong in it. We have to check it, whether it is in hospital, whether it is in a registered recognized chemist shop, anywhere we have to check our blood pressure fortnightly. Fortnightly when we are risky, but at least once in every month. It is usually measured with an instrument called sphygmomanometer that we all know. Our blood pressure is recorded in 2 numbers, that is systolic and diastolic. Very often we see, what is your BP? 128. This 128T or 130 130 is the systolic part and 80 is the diastolic part. The letter which is written above is the systolic part, and the number which is written below is the diastolic component. If blood pressure level is more than 140 by 90, we have to initiate medicine. That is a recommendation nowadays. Whether systolic BP is more than 140 or whether diastolic is more than 90, either of these two or both of these two, in any case, we have to initiate treatment for hypertension. On 17th May, we all celebrate World Hypertension Day. Very recently, it has this concept of World Hypertension Day has begun, and on 17th May, worldwide, we celebrate this World Hypertension Day with the motivation that with someday or sometime, possibly we will be allowed, we will get that satisfaction to make the people aware about hypertension. So it is very, very important. How can we prevent this? That is another big question that comes to our mind. Most important thing is lifestyle modification. What is lifestyle modification? Whatever I have spoken for last few minutes, just concentrate on that. Having regular exercise is a good habit. Stop smoking it adds some more salt to your food. Stoppage of alcohol, it makes your food even more tastier. So, I mean, if you consider it as a whole, regular exercise, stoppage of smoking, stoppage of alcoholism, processed food, and do not touch processed food, avoid deep fried foods, half-baked foods are poison, so do not go for that. These are the things that we have to follow. And one very important thing that we often underestimate, I am repeatedly saying, just manage your stress. You should know how to manage stress. There are many centers who are helping to manage your stress. We have to be very cautious about this stress management. Otherwise, everything will go in vain. Regular exercise, what it does, whenever hypertension is concerned, we all know when we do regular exercise, our heart muscles gets stronger. It produces more cardiac output. And when it is producing more cardiac output, there is lesser atherosclerotic plaque in the arteries, so blood pressure comes down sharply with mere increase in exercise. It's 35 minutes of brisk walking. It's good enough to take your blood pressure down to 5 millimeters of mercury. Systolic with 5 millimeters of mercury, you can bring it down with the help of nearly 35 minutes of walking. Weight reduction is another important thing. With the help of exercise, you can reduce your weight. With every 5 kilo weight loss, you are going to reduce 1 millimeter of mercury blood pressure. So that is how it helps. That is how it helps. If you reduce your salt intake, if you stop your processed food, go for healthy eating, fibrous green leafy vegetables. If you go for these sort of foods, then you are going to get the benefit out of this. And what sort of benefit? DASH diet. I don't know whether you are aware of this or not. DASH diet or Mediterranean diet, eating small amount of food. Don't go for binge eating. That is a very bad practice. Potassium-rich food. That is very important. I have to speak another day for potassium-rich food. Because this is not only important for in terms of blood pressure control, it's good for our heart, it's good for our kidney, for everything it is required. And limiting the amount of sodium, I have already spoken about it, that do not take any excess salt. Just go with the amount of salt that is required to have taste in your food. But nothing more than that. What is DASH diet? DASH stands for dietary approaches to stop hypertension diet. Now, eating DASH diet, that is rich in whole grain, fruits, vegetables, and low fat. Dairy products, skimmed and saturated fat is not there, and cholesterol saturated fat is not there. And with the help of this DASH diet, you can reduce your blood pressure by 10 to 11 millimeters of mercury. So a mere change in diet can do a lot in terms of your blood pressure reduction. Reduce sodium intake, I have already spoken about it. Quiet smoking is very, very important because it not only it promotes your heart attack, it stiffens your artery. There is increased atherosclerotic plaque. There is more chance of cerebrovascular accident. There is more chance of cardiovascular accidents. So smoking is just not tolerable by any means. Regular blood pressure monitoring is very important. If we consider, I have already spoken that if somebody is having hypertension, non-hypertensive patient, then he or she should monitor blood pressure at least fortnightly. That means once in every 14 days. And if a person is not having blood pressure, but having positive family history or other factors that I have spoken, then he should check his blood pressure at least once in every month, because you never know when it will shoot up. Just don't wait for that time to come when you will feel any discomfort, because that might be too late. So it is better not to wait for that time. Stress management is, if it is possible, then you can take the help of the psychologist or any other different sort of exercise, different sort of yoga. All these are recommended for regulation stress management. If you can do it by your own, it's good. If you can't, then you can take the help of other psychologists as well, or other physiotherapists to take care of this stress. Physiotherapists, because different sort of massages releases this anti-stress hormone. The stress, whatever the damages that take place because of stress, is because of stress hormone. And when this anti-stress hormone or release increases, the stress hormone comes down automatically. So you are bound to get the benefit. Adherence to medicine. This is a very common problem among patients, especially in our part of the world. Patients, whenever they feel that they're in good state of health, suddenly they stop medicine. just good for nothing. They just stop medicine with the thought process that yes, I am cured and no more medication is required. It's not at all recommended. Yes, there are situations when drug dosage can be changed. There are situations then new drugs can be added, but without the consultation to your doctor, never ever stop your medicine. That may be very very detrimental for you, because you never know when this blood pressure will shoot up, and it will, and a cerebrovascular accident will take place in any early morning. And if once it takes place, you can't revert it back. You have to face the consequences. So it is better always get adhere to your treatment. And if you have any doubts in your mind, then talk to your doctor. Try to maintain your blood pressure at the level of 130/80. We have to maintain it below 140/90, but it is better to go with 140/80. At last, I would like to suggest that there is nothing more precious than having a fit and healthy life. That is very true. If you have money for investment, then invest it after your health. That is a very very valid uh, uh, sound. That is a very 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 valid narrative that has been created for last few years, and I do support it. Possibly you can understand the importance of this. Your consumption of drug, regular medication, regular checkup to your doctor is not wastage of your money. It's basically a good investment that you are doing just to prevent your future loss of money. So nothing more to say at the end. I should say that have a healthy diet, healthy lifestyle, healthy mind. Take your stress down. Don't go for processed food. Do not smoke. Don't consume any sort of half-baked trans fat containing food. Do not take any sort of additional salt. Monitor your BP once in every month to a skilled person, by a skilled person, and talk to your doctor. If you have any doubt in your mind, those who are already hypertensive, please continue your medication. And if you have any doubt whether to go with your medication or not, then take the suggestion, talk to your doctor, take the suggestion from your doctor's end. No need to talk to your neighbors or your friends, those who are not a specialist in this particular field. So talk to the specialist and then do whatever is required. At the end of the day, on the eve of this World Hypertension Day, we should take that promise that we will be cautious, we will be careful, we will monitor our health, we should have a good habit to prevent the progression and destruction of this silent killer disease called hypertension. Thank you.